Derek and Melanie, just 2 of the 800,000 or so adults in Wales with chronic illnesses, long-term conditions that can mean years of treatment and care. With an ageing population, it's a growing problem. So how well is the health service dealing with it? 25-year-old Melanie has always loved athletics, but at 13 she was diagnosed with type 1 diabetes, leaving her dependent on insulin.
I don't think that the support is there at all as an adult with a chronic illness. I mean, it's really not looked at. The psychological side of having the condition is completely ignored, really. Thankfully, I've been part of kind of some groups with the charity Diabetes UK, so we've worked with young people our own age, to talk about the condition, which has really helped. But otherwise, there would be nothing at all.
Derek moved to Wales 14 years ago. He has advanced COPD, a respiratory illness that means he needs an oxygen pump to survive.
In England, oddly enough, I felt I had no support whatsoever. Credit to the Welsh National Health Service that it's only since I've been in Wales that I've had some good support. Luckily, I have telephone numbers to 2 respiratory nurses, an oxygen nurse and a normal respiratory nurse. So if I get a problem, I can just make a telephone call.
2 different experiences that tally with the Wales Audit Office's findings. Its report shows there's been some progress since it last looked at the issue of chronic illness back in 2008. Increased investment in community-based services, for example, more specialist nurses, and more patients able to get access to education programmes. That's led to a reduction in hospital admissions for some chronic illnesses. But several health boards still lack a detailed plan for delivering community-based care. Over half the services already available are only open on weekdays, and waiting times are generally too long.
As our populations grow older, you can start to see the demand on the health service increasing. So it's important that the shift in services we are seeing continues. And clearly that hospitals and health boards have well-costed and clear workforce plans that indicate how those changes are going to be made.
The Welsh Government says it's pleased this report recognises the progress that's already been made, but it admits there's still much more work to do. It will now consider the recommendations.